1 in 8 women will face breast cancer in their lifetime. It's the second most common cancer in women and a leading cause of cancer-related deaths globally. Yet, so many of us don't really know what to look for until we're already worried. Hi, if you're new here, I'm Dr. Esra Shermadou. I'm a board-certified family medicine physician. And in this video, we're going to cover what breast cancer is, who's at risk, how to protect yourself, and how to approach screening with confidence. Because when you understand your body, you're not just informed, you're empowered and ready to take action to improve your health. So, what is breast cancer? Breast cancer occurs when cells in the breast begin to grow uncontrollably. These cells can form a tumor that can sometimes be felt as a lump, or it can be caught on imaging like a mammogram, ultrasound, or MRI. There are different types of breast cancer, and staging depends on 4 key factors. Number 1, tumor size. Number 2, whether the cancer has spread to lymph nodes. Number 3, if it has metastasized to other parts of the body. And number 4, the presence or absence of certain biomarkers like estrogen, progesterone, or HER2 receptors. These features not only determine the stage of the cancer, but also help guide which treatment options are most effective. Now, let's briefly walk through the main stages of breast cancer so you have a general sense of what they mean. First, we have ductal carcinoma in situ, or DCIS. This is a non-invasive type of breast cancer. Think of it as stage 0. The cancer cells are contained and haven't spread. Then we have early invasive breast cancer, which includes stages 1, 2A, and 2B. The cancer has started to spread into nearby tissue, but hasn't moved far. Then we have locally advanced breast cancer, which involves stages 3A, 3B, and 3C. The cancer is more sensitive in the breast and may involve nearby lymph nodes. And finally, we have metastatic breast cancer, or stage 4. This means that the cancer has spread to other parts of the body. And while it's not curable, it is treatable. And newer therapies are helping people live longer with better quality of life. Now that we've discussed what breast cancer is and how it is staged, let's talk about risk factors. There are 2 main categories of risk factors: modifiable ones and non-modifiable risk factors. Non-modifiable risk factors include things that we can't change, and this includes age. So the risk of breast cancer increases after age 40, but the median age in the US is around age 62. Family history of breast or ovarian cancer also increases your risk of developing breast cancer. Genetic mutations like BRCA1 and BRCA2 mutations. Personal history of breast conditions. Having dense breast tissue. And your menstrual life cycle. So starting menstrual cycles before age 11 or experiencing a later menopause after age 55. These can increase your risk of breast cancer, and this is thought to be due to an exposure of extra high levels of estrogen throughout your reproductive years. Modifiable risk factors include maintaining a healthy weight, regular physical activity, limiting alcohol consumption, and not smoking. These lifestyle factors may not eliminate your risk completely, but they can significantly reduce it. Taking small, consistent, and sustainable steps can have a big impact over time. On to screening for breast cancer. Screening is one of the most powerful tools that we have today. Mammography can detect breast cancer early, when it's most treatable. Guidelines vary slightly about the best age to start screening and how often to do so. Some guidelines will recommend starting mammograms at around age 40 and continuing annually after that. Others suggest beginning at the age 50 and screening every 1 to 2 years. Talk with your doctor to determine the best schedule for you, especially if you have additional risk factors, as this will factor into when you should start and how often you'll need to get rescreened. Breast self-awareness through self-breast exams is also important. It's not so much about doing structured self-exams, but more about being familiar with how your breasts normally look and feel. If something changes, a lump, skin change, or nipple discharge, get it evaluated. It's important to note that self-breast exams do not replace screening. It's just important for knowing what's normal for your breast tissue and what's not. This way, you can pick up on any abnormalities quickly and be evaluated by your doctor to determine the next best step. While we can't change our genetics, we can take steps to support our long-term health. We'll cover 5 lifestyle factors that can help reduce our chance of developing breast cancer. And these include, number 1, nutrition. It's important to focus on getting nutrient-dense foods. These include getting adequate fiber, lean proteins, whole grains, and healthy fats. Number 2, movement. Aim for at least 150 minutes of moderate activity each week, plus strength training. Number 3, alcohol. Limiting alcohol to 1 drink or less per day can reduce the risk of breast cancer. Number 4, weight management. Excess body fat not only increases the risk of breast cancer, but also uterine, ovarian, and colorectal cancers. Originally, it was thought that higher levels of body fat increased estrogen and therefore increased cancer risk. We now know, however, that the mechanism is most likely due to metabolic changes. And number 5, managing stress and sleep. Chronic stress and poor sleep impact hormone regulation and immune function, thus increasing risk of developing breast cancer. Prevention isn't about perfection, it's about progress and consistency. If you have a strong family history of known genetic mutations, you're considered high risk. There are also other screening tools that can be used to determine if an average woman might be of high risk. Being considered high risk does not mean that a breast cancer diagnosis is inevitable. It means you're eligible for more tools to decrease the chance of developing breast cancer in the future. These include enhanced screening, like with an MRI, genetic counseling, risk-reducing medications, and lifestyle guidance. This is a moment to feel empowered, not anxious. Proactive care leads to better outcomes. I know breast cancer can feel overwhelming, but knowledge truly is power. So, to recap, know your risk, stay on top of screening, prioritize your health through lifestyle, and don't ignore changes in your body. If you're unsure where to start, schedule a conversation with your provider. Breast cancer doesn't have to be a mystery, and it doesn't have to control the narrative. You deserve answers, support, and a clear plan. And now you have that. If this video was helpful, make sure that you share it with someone you love. It might change their life. Like, subscribe, and drop your questions in the comments. Let's keep this conversation going. Until next time, be well, stay informed, and take good care of yourself.